Good morning, everyone, and thank you for joining me this Tuesday morning for another episode of Tooth Teacher Tuesday. Dr. Z here, and today talking through a subject, a very popular, common question we get at the dental office that is really not anything to do with our dental health, but more just for dental cosmetics, which is the question, what are my options for whitening my teeth? I feel like my teeth are a little bit stained or darker than I'd like them to be. I'd like them to be brighter. So, what options do I have? And so, I always start off by telling patients, if you haven't tried, the over-the-counter stuff, the whitening toothpaste, whitening strips, stuff like that, that'd be a good place to start as a baseline. Realistically, those over-the-counter products, they don't really do much to whiten your teeth, which you might ask, well, why are they able to advertise that they do if they really don't? And it basically boils down to the FDA doesn't regulate anything cosmetic related. They just regulate the actual, health portion of dental products. So, those products aren't going to harm your teeth. So they're not really able to shut down any of these companies selling those over the counter products. Doesn't mean that you can't use them. I mean, they're good if you're just trying to touch up and bring your smile a shade wider. Maybe those products would work, but for most people, if they're trying to go up a shade or two as far as the brightness of their teeth, then they're going to find that those products don't do much of anything. At best, maybe help maintain the brightness of their smile once they get to the level that they do like, but not really going to do anything to improve things. So, kind of my little aside about those whitening strips and toothpaste and whatnot. And that also goes for, we've talked in the past about activated charcoal. I've already mentioned I do not at all support the use of that. Activated charcoal, it will brighten your teeth, but it's also very abrasive and will wear away the enamel of your teeth. So activated charcoal is a no-go. Please do not use that to whiten your teeth. So as far as what's actually going to be effective to whiten your teeth, there's a range of different products and techniques and procedures that can be used to whiten teeth. And, with that range, I always tell patients the more mild stuff, again, is a good place to start because the more mild the whitening agent is, may not be as effective, but there's also a lower risk of your teeth becoming sensitive. And that is the risk we run when we start using stronger whitening agents, is that they're just so powerful that they can sometimes make our teeth sensitive. And so, again, doesn't mean we don't use those stronger techniques, but again, I like to start with a good baseline and start with the milder stuff first. So, what do some of those options look like? As far as what you can get at the store, about the only thing that I would say that you can buy at the store that is even remotely effective would be little professional whitening kits like this. This is from Colgate. As anyone that's viewed these videos know, I don't have any backing. I have no financial interest or conflict of interest. Colgate has these kits. Crest also has these kits. So I don't have any brand loyalty to either of them. Again, those are a good place to start. Might see some results with those. Again, very mild whitening agent because it's at home use. So, if you try that and it gets you the results you want, perfect. If you're wanting to go something stronger, then that's where you want to start talking to your dentist about some things that they can offer you. And the step above that would be trays like these. These are whitening trays. Again, this is just one brand that we use in my office. There are other great brands and systems out there too. So, but this is a whitening tray that's just kind of a generic one-size-fits-all. Um, Again, kind of a step above those at-home kits, and you do use this at home. It's just a little bit stronger whitening agent. Um, so talk with your dentist. They may offer something like that at their office, but that's something that you can just kind of use on your own. Step above that would be, like I said, those trays were kind of generic one-size-fits-all. Step above that would be making your own specific custom bleaching tray. That's going to be, a little plastic piece like this. It looks about like a clear aligner tray for orthodontics, but a little bit different. And again, this is something you use at home, and you have to buy the whitening agent for it that you can get preferably from your dentist. Can you buy this stuff online? Yes, but you don't know what you're getting, so better to get it from your dentist so that you know you're getting it from a trusted source. But again, these are something that are custom fit to match your teeth and has a little bit more control about where the whitening agent goes, and also allows for a little bit stronger whitening agent to be used. So it's something that you just wear for 30 minutes every few days and start to see your teeth getting whiter, and kind of wear them until you get to that level of whiteness that you like. And kind of the final step above all of that would be doing some kind of in-office whitening with your dentist. It's not a procedure that every dentist offer, but a lot of us do. And again, that's something in office because we're using the strongest whitening agent that we have. So you need that professional supervision to make sure we're administering it properly to minimize the chance of causing tooth sensitivity or causing any tissue burn from the whitening agent getting on your gums. But the great thing about those in-office whitening treatments is it's pretty much an instant, same-day process that you go in at a darker shade and you come out brighter, maybe not entirely at the shade you want, depending on how white you want to go, but we kind of take it in small steps to make sure we don't blast your teeth with so much whitening that your teeth are just crazy sensitive. So, but in my experience, most patients, they'll leave with their teeth very white and don't have to come back for a second round of treatment. But again, downside with that is your teeth are going to be more prone to sensitivity. But the great thing about it is, there's no waiting. It's especially useful if you've got, a wedding or some other big event coming up that, in a very short span of time that you can't wait on the slower process. You just want to get them white and be ready for your big event. And so, yeah, those are kind of our different whitening options. So, hope that was helpful for anybody that's pondering whitening your teeth. And I always tell patients too, just rest assured, the bright Hollywood smiles that you see are not natural. It's normal for our teeth to have a little bit of a yellow hue to them. That's just natural anatomy. But if, doesn't mean you have to be satisfied with that. If you want to go whiter, you can, but I feel like a lot of times people feel like if their teeth aren't bright, paper white, that their teeth are too dark, and that's not true. That's just the false standard that social media and TV and movies give us. So anyway, hope that was helpful, and thank you for joining me this morning, and I hope you will join me on next week's Tooth Teacher Tuesday. Have a great week, everyone.